Hello, I am Professor Elisabet Hagert. I'm a senior consultant hand and orthopedic surgeon at Aspetar. I am head of hand, wrist and nerve surgery at Aspetar, but also a professor of orthopedics at Qatar University. I have a background from the Middle East. When I was a teenager, I lived in Kuwait, and so I graduated from the American School of Kuwait. After this, I went to medical school at the Lund University in Sweden. After my MD, I moved to Norway, where I spent 4 years doing my internship and parts of my orthopedic surgery residency. In 2001, I moved back to Sweden, where I started my hand surgery residency at the Karolinska Institute in Stockholm. In 2010, I had the opportunity to move to Stanford, California, where I did 1 year of postdoc fellowship at Stanford University. After this, I moved back to Stockholm, and I ended up spending a decade building private hand and orthopedic surgery clinics in the country, where I worked as CEO, medical director, and senior hand surgeon. In 2022, I had the amazing opportunity to be offered a position at Aspetar to come and support Aspetar ahead of the FIFA World Cup with regard to hand, wrist, and nerve services. Aside from my academic achievements, my clinical work is extremely important to me, and I'm very happy to contribute to the athlete health at Aspetar with regard to hand, wrist, elbow, and nerve surgery. One of the things that we do here is that we take care of professional athletes, for instance, handball players, basketball players, etc., who are frequently injuring their hands as part of their games. I work very closely with my hand physiotherapy team. So we work side by side to treat our athletes to get them back on track as fast as we can. I think the most unique thing about Aspetar is that it truly is a one-stop shop for anyone with athlete or sports injuries. Say you sustain an injury while playing a game, either as a professional athlete or as a hobby athlete. You come to Aspetar, quite often you're seen by one of our superb sports medicine physicians who will do an initial assessment of your hand, wrist, elbow or nerve injury. After this, you will be sent to our radiology department, where we have state-of-the-art equipment to do advanced MRI imaging and ultrasound of your injury or disease. After this, I will see the athlete or patient in my clinic, where we can do a further assessment with regard to the management that is needed. If we do not need to go for surgery, we collaborate very closely with our physiotherapists to provide either splints, which are custom made for the patient, and/or training programs. If we need to go for surgery, we can offer both minimally invasive techniques as well as open techniques. This includes arthroscopy of the hand joints, the wrist joint, and the elbow. We can do arthroplasty, meaning that we can change joints in the hand if they have been worn out. It also includes doing endoscopic procedures, such as endoscopic carpal tunnel release, where you use a camera to release the nerve in the wrist. Overall, to come to Aspetar, you have one place where you have all of your needs met with regard to sports, hand and orthopedic surgery. Working with athletes is a unique demand and challenge and the most fun aspect of my work. And what we need to take into consideration is how is the athlete dependent on their hand function, and what can we do to get them back quickly to play, but also to prevent further injuries from happening. We do this by educating our athletes, both from a surgeon perspective and also from a physiotherapy perspective. Because the best injury is the injury that never happens. The surgery team and the physiotherapy team at Aspetar warmly welcome you to schedule an appointment to get a detailed assessment of whatever disorder, injury or condition you might be suffering from.